Are you someone who has lost a lot of weight, either naturally or with surgery such as bariatric surgery? But now you're left with a lot of loose, saggy skin in the abdomen, in the arms, and you don't know what to do about it. Today, we will discuss about plastic surgery after massive weight loss. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Aesthetic Health. Bye. Now, let me start by saying that losing a lot of weight is not easy. Some people do it with diet and exercise and it's extremely commendable. Some people might require some help. People who diet and exercise in order to do it, they get bariatric surgery. Whatever it is, either way, it is not easy to lose a lot of weight. So, when people have lost 20, 30, 40 kilos, they were 110 kilos before, they're 70 kilos now, that is extremely commendable. They have taken charge of their life and they're in a better place. Unfortunately, they're often left with some sequelae. They are left with a lot of loose skin. See, the thing is, when you lose a lot of weight, the fat goes away. But all that extra skin that was there, that does not completely go away. So what you're left with is a 70 kg person inside the skin of a 120 kg person. And this is bad obviously for two reasons. One is obviously cosmetically, it doesn't look good to have loose hanging skin everywhere. Secondly, psychologically, it's a reminder of the weight they used to be. They're not able to move on with their life. And for this, plastic surgery is required. Now, typically, this loose skin is present in multiple areas. You have it in the chin, you have the saggy arms, you have a saggy roll of skin all around the abdomen, and you have saggy skin in the inner thighs. These are typical areas in which there is loose extra skin. And what we do with massive weight loss plastic surgery is we remove this skin. As simple as that. We do an arm lift for the arms, we remove skin here. We do a lower body lift for the lower abdomen, we remove skin all around. And we remove skin in the inner thigh, what is called an inner thigh lift. Now, before we come to talking about these procedures, you might ask, is there any non-surgical way to do this? Can we get rid of the skin without surgery and cuts? Unfortunately, the answer is no. While there are non-surgical skin tightening options, they don't work for this much amount of loose skin. They work for a little bit of loose skin. Massive weight loss individuals who have lost a lot of weight and a lot of loose skin, non-surgical methods simply don't cut it. So, what are the surgeries? Main surgeries include a lower body lift for the abdomen, a chest lift in men or a breast lift in women, arm lift and inner thigh lift. Now, it's not essential that every single person needs every single one of these surgeries. It depends on where all there is loose skin and where all this loose skin is needed. Typically, the one that most people need is a lower body lift, getting rid of the loose skin in the lower abdomen. Take a look at this gentleman here. He lost a lot of weight and he was left with all this loose skin. How do we treat this? Let us talk about the lower body. So in the lower body lift, we literally remove a circumferential piece of skin, like a ring of skin, all around, from the front to the sides, all the way to the back. This is because there is loose skin all around. This surgery is done under general anesthesia. You are admitted to the hospital for a couple of nights. It is very safe. After the surgery, there is a scar running all around your abdomen. You go home in 2 days. This scar is very low and it is hidden inside your underwear. So, after the surgery, there is a thin scar all along the lower part of your abdomen. It's a very low scar that gets hidden inside your underwear. You go home after 2 days. Now, this is not a small surgery. You need to give yourself time to recover from this surgery properly. What makes the surgery a little bit tricky to recover from is that there are stitches on the front and the back. So, the person's position has to be very well taken care of. He can't bend too far forward, he can't bend too far back. Otherwise, it will pull on those sutures. This is why you will need some help for the first week after the procedure. During the second week after the procedure, you will be able to look after yourself and move around by yourself. 3 weeks after the surgery, you can start going out and you can probably return to work as well. Let us now see some results of the lower body lift that we have performed. So here you can see the transformative effect of a lower body lift. It literally gives you a flat abdomen. You look how you feel. You are no longer a 70 kg person in a 120 kg scale. You are a 70 kg person in a 70 kg scale. And this has a major psychological impact. Our patients are always very, very happy after this surgery. What about other areas? So in the arm lift, we remove a piece of skin like this in the arm. There is a scar from the elbow to the axilla. In the inner thigh lift, there is a scar running all along the inner thigh. And in the chest lift, there is a scar along the chest. These are all smaller procedures compared to the lower body lift. Now, we cannot do all these surgeries together. You cannot operate on so many parts of the body together, the body won't be able to heal properly. So we typically stage. Usually patients require 2 stages, sometimes 3 stages. We might combine the lower body lift with the arms and the chest lift with the inner thighs. Sometimes, like I said, it might require 3 sessions also. Every single patient is unique. Every single patient needs a consultation with their doctor about what is best suited for them. If we are staging this, the gap between these stages will typically be around 3 to 4 months. Now, I hope this video was useful to you. If you have any more questions about lower body lift, you can get in touch with us. As I said, this is a very gratifying surgery for us to perform because the patients are always extremely happy that they finally have the body that they feel like they have. And when they run, for example, they don't have blue skin flapping around and they're able to move on with their life and leave their old life of being 100 plus kilos behind. Thank you. Have a great day.